Hello, I am recording for CNA Test number 14. This includes Chapter 40, Wound Care, Chapter 41, Pressure Injuries, and Chapter 42, Heat and Cold Application. You need to remember that a partial thickness wound caused by the scraping away or rubbing of the skin is an abrasion. A resident that has an open wound on the left lower leg is caused by poor arterial blood flow. This wound is going to be considered an arterial ulcer. Key word there, arterial, and then the answer is arterial. Skin tears are going to be caused by removing tape or adhesives. A patient that has an open wound on her left foot, she has poor circulation in her arteries and veins, and her wound is going to be considered circulatory. It's considered circulatory because she has poor circulation on both arteries and veins. Tissues are going to be injured, but the skin is not broken, and this is going to be considered a closed wound. So the skin's not broken, the tissue underneath is injured, a closed wound. A wound has separated, abdominal organs are protruding through the wound. This is called an evisceration, E-V-I-S-C-E-R-A-T-I-O-N. A wound that involves the skin, muscle, and bone is considered a full thickness wound. A condition in which there is death of a tissue is going to also be considered gangrene. A wound that has torn tissue and jagged edges is considered a laceration. The dermis and epidermis of the skin are broken. This is going to be a partial thickness wound. Drainage that is thick, green, yellow, or brown is going to be considered that purulent drainage. Thin, watery, blood-tinged drainage is called serosanguinous drainage. Bloody drainage is considered sanguinous drainage. A resident that has an open wound on the right lower leg, and the patient has poor blood flow through her veins, her wound is considered a stasis ulcer. So poor blood flow, an open wound on the right lower leg, this patient has a stasis ulcer. A hematoma is going to be a swelling that contains blood. Skin tears are often caused by direct pressure on the skin. To prevent skin tears, you're going to need to keep your fingernails short and smoothly filed as well. Oh, goodness. Arterial ulcers usually occur on the toes and the outer side of the ankle. Common causes of arterial ulcers are going to include diabetes. Circulatory ulcers can occur on the legs and feet. Itching is also going to be a common sign related to venous ulcers. A patient has a venous ulcer. The patient is needing repositioning at least every 2 hours. An obese patient is also going to be a risk factor for venous ulcers. Diabetic foot ulcers can affect the nerves and the blood vessels. Protein is needed for wound healing. Excessive loss of blood in a short time is going to be considered hemorrhage. When observing a wound, you can observe the surrounding skin as well. A drain that is inserted into a wound, its purpose is going to be to get rid of the drainage that leaves the wound through the drain. The purpose of wound dressings is going to prevent those microbes from entering the wound and causing infection. If a dressing is loose, what can happen? The drainage could escape and get all over the patient and be bad. The nurse asks you to apply a dry, non-sterile dressing. You need to remove the tape by pulling it toward the wound. The nurse asks you to apply a dry, non-sterile dressing. The dressing change causes pain and discomfort. What should you do? You need to ask the nurse when the pain medication was given and wait 30 minutes before you begin your dressing change. Pressure injuries usually occur over bony prominences. The person who is at least risk for a pressure injury is also the person who has shortness of breath. So nothing really with shortness of breath and a pressure injury have to do with each other. Friction is going to be the motion that drags or rubs against the skin. An early sign of pressure injury is going to include a tingling in the area. Patients that are bedfast are repositioned at least every 1 to 2 hours. The recommended positioning for preventing and treating pressure injuries is the 30-degree lateral position. To prevent pressure injuries, you must keep the patient's skin clean and dry. Pressure injuries can occur where skin has contact with the skin. You can prevent this by using pillows. To prevent pressure injuries, patients sitting in chairs need to shift their positions every 15 minutes. A resident has a bed cradle on the bed. For linens, you need to use a draw sheet because those sheets aren't going to fit anymore. The pressure injury prevention involves identifying patients that are at risk ahead of time. Which member of the healthcare team decides which dressing to use, and it's going to be the nurse. A compress is a soft pad applied over a body area. To constrict means to be narrowed. To dilate means to expand or open wider. Cyanosis is a bluish color. Hypothermia means the person's body temperature is very low or cold. Heat and cold applications do the following, and they promote comfort with patients. A nurse asks you to apply a heat application. Before doing so, you need to make sure that the procedure is within your job description at that facility. Heat applications decrease joint stiffness. When blood vessels constrict, blood flow decreases. So if it's narrowing or constricted, then the blood flow through it decreases. When heat is applied, older patients are at risk for burns. A patient that has a knee replacement, heat applications are going to be allowed except over the area of the implant because you could potentially go over that metal and harm the patient even more. Heat and cold applications are applied for 15 to 20 minutes. An aquatherma pad is going to be an electrical device that has water that flows through it, but it has to have electricity to run it. A cool application is going to be 65 to 80 degrees Fahrenheit. A warm application is going to be 93 to 98 degrees Fahrenheit. The temperature of an aquatherma pad is usually 105 degrees. You are going to apply an aquatherma pad. You fill the heating unit with distilled water. Before applying an aquatherma pad, you need to put the pad in a cover. Cold has the following effect, and it's going to be numbing the skin. After applying a dry, cold application, you need to check the application site every 5 minutes. You should also take vital signs when a cooling blanket or warming blanket are used. You guys have been doing super good. I'm super proud of you. You are on CNA Test 14. I owe you guys lots and lots and lots of lab time. I'm hoping to get in quite a bit before Christmas break. But what we don't learn, we will be learning on site at clinical site, which is just fine and goes along with the CNA book. Also, you need to keep in mind that you should have your TMU profile completed. So go back to that text message or email and make sure that that is finished. Thank you, and I hope you have a great week.